Welcome to Clinical Chemistry High-Yield Questions for Medical Technology Board Exam Part 2. Let's start. Which compares the result obtained for one specimen with the previous result obtained for the same patient? A. Delta check, B. Benchmarking, C. T-test, D. F-test. The correct answer is A. Delta check. Siya yung comparing the result from the previous result within the same patient. Ang benchmarking naman, comparing your result with other laboratories. Ang t-test is to determine whether there is statistically significant difference between means of two groups of data. Ang f-test naman, difference between standard deviation of two groups of data. Paki-remember, kapag t-test, mean. Kapag f-test naman, SD. SD, okay? Which illicit drug is commonly referred to as ecstasy? A. Cocaine, B. Opiates, C. Lysergic acid, D. Methylene dioxymethylamphetamine. Ecstasy is letter D. MDMA. Next, which is the result of urea being reabsorbed into the circulation due to obstruction? A. Postrenal, B. Prerenal, C. Renal azotemia, D. All of the above. Kapag sinabi natin obstruction, that is post-renal. Obstruction, post-renal. Next, which of the following is the best needle gauge used for pediatric venipuncture? A. 21, B. 23, C. 19, D. 22. The correct answer is letter B. 23. Kapag wala sa choices ang 23, pero merong 22, 22 is your answer. And also, recall din at 2021 January, ilang minutes daw pwede magtagal ang tourniquet sa kamay. Walang nakalagay na 1 minute or 60 seconds. Pero, meron doon 2 minutes. 2 minutes yung minimum na nakita ko. Yung pinaka maliit, pinaka least 2 minutes. The rest, iba na. So, that is the best answer there. 2 minutes po ang tourniquet application if wala pong 1 minute. So, medyo tricky talaga ang mga questions sa board exam. So, mag-ingat po kayo. Next naman, which are anti-asthmatic drugs? A. Theophylline theobromine, B. Digoxin lithium, C. Theophylline theobromine digoxin, D. Theophylline theobromine digoxin and lithium. The correct answer is letter A. Theophylline and theobromine only. Digoxin, that is for your heart. Ang lithium naman, that is for antidepressant. Next, what protein protects the kidney from harmful effects of free hemoglobin? A. Hemopexin, B. Haptoglobin, C. Albumin, D. Macroglobulin. The correct answer is letter B. Haptoglobin. Ang haptoglobin, siya yung nagbabind sa mga free hemoglobin. Next, term used of an individual who subjects himself for a drug testing. A. Patient, B. Donor, C. Sender, D. All of the above. Ano daw tawag sa tao na nagpapadrug testing? The correct answer is letter B. Donor. Donor ang tawag sa taong nagpapa-drug testing. Hindi po patient. Dapat the temperature for your drug testing, the sample is 32.5 to 37.7 and must be taken within 4 minutes. Kapag wala sa range ang temperature, the first thing you do is to call your, first you record it and call your supervisor or employer. Then, ang drug testing should be maybe witnessed or unwitnessed. Okay? So next, which is not a trophic hormone? A. Growth hormone, B. TSH, C. LH, D. FSH. Hindi po trophic hormone, that is your GH, growth hormone. Next, which enzyme has a moderate specificity for liver, heart, and skeletal muscle. A. AST, B. ALT, C. LDH, D. ALP. The correct answer is letter A. AST. Ang ALT, that is, mas grabe siya sa liver. Ang LDH naman, halos lahat. Ito yung pinaka non-specific na enzyme, ang LDH, kasi meron siya halos lahat lalo na sa RBC. Maraming LDH ang RBC. Next, ang ALP, mostly sa bones. Okay? Next, lipoprotein, responsible for carrying exogenous triglycerides. A. Chylomicrons, B. VLDL, C. LDL, D. HDL. The correct answer is chylomicrons. So, ang chylomicrons, ito ang na exogenous triglyceride. Siya ang pinaka-largest but less dense. Ang VLDL naman, siya yung endogenous triglycerides. So, ang palatandaan ko dito ay sex-ven. Chylomicrons, sex-ven. Chylomicrons, exogenous, VLDL, endogenous. Tapos, ang LDL mo naman, siya yung tinatawag nating bad cholesterol. Why? Because it transport cholesterol to tissue. At siya yung most atherogenic. Ang HDL naman, siya yung nagre-reverse ng cholesterol transport. Recall din sa board exam. The answer is HDL. Good cholesterol kasi from the tissue to the liver. Siya yung smallest but most dense because ang HDL, component niya is mostly protein. The chylomicrons is mostly triglycerides. Ang component kaya less dense siya. Ang beta VLDL mo naman, siya yung tinatawag natin floating beta lipoprotein. Ang lipoprotein A is sinking pre-beta lipoprotein. Ang palatandaan ko dito, kapag beta VLDL, B stands for balloon, so mostly ang mga balloon, float, di ba? Lumilipad, floating. Siya, yun ang palatandaan ko. Ang lipoprotein A naman, so sinking, so kapag nalulunod ka, sink ka, anong ginagawa mo? Sumisigaw ka ng, so lipoprotein, so corny, pero yun. Next. Okay na pala. So, thank you so much and God bless us all. So, good luck, March takers. Kaya nyo yan. Tiwala lang sa sarili, RMT 2021. Goodbye, guys. Thank you.